With the top story on everyone's mind, the race for a COVID vaccine. We are even launching a special series this week. We're covering every angle for you because it can't come soon enough. I'm sure we all agree. So here's what you need to know. Today is a critical day. The CDC's Vaccine Advisory Committee will meet to decide who should get vaccinated first, with healthcare workers a top priority. There are 6 promising vaccine candidates. 2 are already under consideration by the FDA for emergency authorization. So once approved, the military, as we understand it, is handling distribution. And we do know the vaccine will be free. But of course, the big question this morning, when will it all start? How will it change our lives? For that, we turn to NBC medical contributor Dr. Ben Gupta. He's been treating COVID patients really since the beginning of the pandemic. And CNBC's senior health and science reporter Meg Terrell is also here. Good morning to both of you.
Morning. Morning.
Dr. Gupta, let me start with you. As we mentioned, the FDA is now scrutinizing data on 2 possible vaccines. How soon will we see a vaccine once they give their official stamp of approval?
Good morning, Chanel. We're expecting that hopefully about 20 million to 50 million doses, depending on which vaccines get approved. If both get approved, Moderna and Pfizer's in this calendar year, might be available to Americans by the end of this calendar year. The point at which most Americans will actually receive a vaccine or will be eligible for it, I suspect, end of late spring. So we're looking sometime in the March, April timeframe when most Americans will start seeing access to it. And then by the beginning of the summer season, June into July, hopefully anybody who wants a vaccine can get a vaccine.
Mm-hmm. So, Dr. Gupta, there's been this debate about who gets the vaccine first. What's the latest thinking on that?
Al, we're going to have greater clarity on that today with this advisory group that's meeting and to give guidance on that to the CDC. But I suspect it's going to be those who are at high risk for exposure. So healthcare workers, frontline healthcare workers. Hopefully we broaden that definition so we conceive of other essential frontline workers like teachers and grocery store clerks in that rubric. There's many others. And then also residents of congregant living facilities, so nursing home facility workers and residents. Those are going to be, I think, the top 2 groups here that will receive the vaccine first.
Meg, let's bring you in here as someone who really knows the business of vaccines. What can we realistically expect once the immunization process actually starts? And I'm hearing there's talk about a vaccine passport. What is that?
Yeah, so this is this kind of futuristic idea where we actually have a requirement to get a certificate of vaccination before we can do things. So as Dr. Gupta was talking about, it's going to be a while before most of us can get a vaccine. It's going to be the most high-risk groups at the beginning because of limited supply. And then folks like Dr. Fauci are talking about spring and summer for everybody really being able to get access. And so then what does life start to look like? Do we have to have that certificate of vaccination before getting on a cruise ship or getting on a plane, for example? Experts I've talked with say that is a possibility. But what about like going to concerts or going to a restaurant? Would you need a certificate of vaccination to do that? That might be less likely, but companies like Ticketmaster are already thinking about ideas like that. Could they have a technology, for example, to link your concert ticket to proof that you've been vaccinated? So these are the kinds of things that are getting talked about. None of it is set in stone yet, but experts are saying we should think about these things, what life is going to be like with vaccines. And they are warning that even as more of us get vaccinated, we're still going to have to wear masks and socially distance for a lot of next year.
Yeah, no surprise there.
But you don't have a choice. People act like you have a choice. For the world at large, normalcy only returns when we've largely vaccinated the entire global population.